Good evening, viewers. My name is Rahul Desai, and hereby welcome you all to the very first episode of Hydration in Diabetes series. Dear viewers, to take us through this diabetes series and why hydration is very much important and its components of this series, let we have our very honorable Dr. Sanjay Kalra sir with us. He is the president-elect of South Asian Federation of Endocrine Societies, and Dr. Sunil Kota. So let me have the opportunity to hand over the platform to Dr. Kalra sir so he can take the session ahead.
Thank you, Rahul, and thank you, Team FDC, for sponsoring this series of educational webinars. And I'd like to thank everybody who is listening to this talk. Now, we all deal in internal medicine, and we have heard the word hydrophobia. When you read about hydrophobia, that reminds you about rabies. It makes you uncomfortable. But there's another word in the lexicon, another new word in the dictionary, and that is hydromania. Now, what is hydromania? Let's meet our guest for today, Dr. Sunil Kota. Dr. Sunil Kota is an eminent endocrinologist from Berhampur in Odisha. He runs a busy practice and he is also one of the most active members of the Endocrine Society of India. Dr. Sunil, before we introduce your topic, what does hydromania mean?
Yes, actually, as you have rightly stated, we are into hydromania. It is the elation and excitement for matter pertinent to water. And if you look at the number of talks that are being planned by FDC, for which we are thankful to them, yes, it is also elation and excitement towards understanding about this particular molecule from this series of lectures.
Mania might be a disease in psychiatry, but when we talk of hydromania, and hydromania is something that Sunil and I are going through right now, and all of us who are logged in are also part of. Hydromania means that we are excited and elated actually to learn more about water. Is water a medicine? Is it a prevention? Is it a cure? This is what we seek answers to. And we will do this over a series of talks, all related to hydration, one talk every fortnight. We'll begin, however, with a discussion of basic physiology. And I invite Dr. Sunil Kota to share with us a few tips, a few insights on the physiology of water. And our topic for today is water as part of our body. And we've titled it The Body, Water Within. So, Dr. Sunil, over to you. And let's see how important, how relevant, how rational hydromania is.
Thank you, sir, for those kind words. I would just be sharing the screen. Just let me know once the slides are visible, then I can start.
Yes, they are visible, and you can move to
Yes,
slideshow now. And we
yes,
look forward to your questions, comments, criticism. Feel free to send them in the chat box.
yes. So as we already understand from our Sanjay Kalra sir that yes, this is a series of topics where we are going to talk about the importance of water. And this is the episode one where I would be conversing with Sanjay Kalra sir about the water within our body, how important it is. uh, uh, it takes me back to our mythological days when our seniors used to tell us the Dasavatara of Lord Vishnu, and the first avatara is Matsya, which happens to originate from water. So the life itself originates from water, and the one significant factor which makes our Mother Earth significantly different from others is the presence of water. So how exactly does it contribute to our body physiology? That's what we are going to deal about today. If you look at the body composition, roughly 60% of the human body is water, and it has got its range between 45 to 75%. If you want to look at other portions, the protein constitutes around 18%, the fat constitutes to around 16%, and minerals and others contribute to another mere 6% of the total body. And theoretically, for completion's sake, I must utter the measures to measure the body water total dilution method, then bioelectrical impedance assay or BIA, Then there is also uh, the turbometry method, which are scientifically used to calculate the body water. And the amount of water that is there in the body keeps on changing with different parameters like factors like age, sex, and hydration levels. Children, they do have higher body water, and as we grow older, the quantity of the proportion of body water goes down. Sex wise also there is a significant difference. If you want to portray a single fact pointer as to what is the percentage of body water is, males do have somewhere between 62 to 63% of body water, whereas females do have 50 to 53% as body water. And of course hydration level is very important. As you are better hydrated, and if you are living in a place which is less humid, less hot, the hydration levels are better. And fatty tissues contain less water than muscle, so the percentage of water can change with the body type. And it has been shown in one of the important studies, this I got from PubMed in 1992. It states that compared to normal weight women, obese women have a lower total body water per unit of weight and a higher extracellular water per unit of total body water. And if I were to be specific about the percentage of water that is there in our body as per the age, look at the male and female distribution from 12 to 50 years. You can
Dr.
see,
Sunil, Dr. Sunil, can you please shift to slideshow mode?
I have already done that, sir. Is it not visible properly?
No, maybe we hide slide and try it all over again.
Okay.
Stop sharing,
Okay.
then try again. So share. Yeah, now the slide has, yeah, okay. Now we can start all over again.
Okay.
With this, I mean, not with the talk, but with the sharing slides, we can start again.
Yes. So sorry for the hiccups.
That's fine. Actually, that's why we are doing this talk on hydration, because now winter is over and it's spring season. Spring is wonderful, but soon we will have the hot Indian summer in front of us, and we should be well prepared. So in spring, the hiccups are fine.
Absolutely. Let me know, sir. Once it is visible, then I can. Is it
It's coming.
is
Now
it
we
the
can
full
see the
screen?
slide. No, but not slideshow.
Uh, but from my end, it is slideshow only. I don't know what is happening.
Okay. Now we can see the slide with the age and male, female, and the percentage.
Okay. But shall I proceed if it is okay?
Sure. Yeah.
Okay. So age-wise, the males from 12 to 50 years, you can see the average water content is 59%, but then the range becomes wider as the person gets older. You can see the range is 52 to 66% in 12 to 18 years male, but it gets widened to 43 to 73% in males between 19 to 50%. Then 51 years and older, the males have 56% water. Females 12 to 18 years, it is 56%, 50% in females between 19 to 50 years, and 47% in females aged 51 years or older. Similarly, if you come to infants and children from birth to 6 months, it is around 74%. Again, from 19 years, from 6 months to 12 years, the average is 60%. But then, as the child infant gets older, he comes to 1 to 12 years, the range becomes widened, and range is 49 to 75%. As we were already alluding to, water roughly contributes to 60% of the total body, and protein around 18%, fat around 16%, minerals and others contribute to around 6% of them. And you can look at the picture at the bottom. Newborn, toddler, and different stages are being depicted, and as the age progresses, the body water goes down significantly. And you can see newborns have 80% of their body composition attributed to water. And where is the water in the body? It is in fact everywhere. And the cells constitute around 60% of the total body water. And one third of the remainder 40% is present in the pericellular spaces, and it is differently present in different organs. You can see brain and kidneys contribute to the organs having highest water. Those are having 80 to 85 percentage. Bones and teeth contributing to least, bones having 20 to 25%, and teeth contributing to 8 to 10%. And then heart and lungs 75 to 80%, muscles, liver and skin having 70 to 75%, and blood having 50% water percentage. And if you look at the flow, this is nothing new. Once the person gets rehydrated, takes fluid orally, intestines help in absorption of water and distribution throughout of the body is done by the blood. And kidney, yes, it is a very important organ as far as maintenance of water homeostasis is concerned. It is associated with filtering, reabsorption, and then elimination is also done through bladder. And if you look at the kidneys capacity, it can drain 20 to 28 liters a day, but can excrete 0.8 to 1 liter per hour a day. So that again is a significant number, and it has got very important functions like temperature regulation by production of sweat. It is important in cellular function. It also is important in waste removal. It lessens the burden on the kidney and on liver by flushing out waste products via urine, sweat, and bowel movements. It lubricates and gives cushioning to the joints. It moistens tissues in the eyes, nose, and mouth. And very importantly, sensitive tissues and body organs are protected by water, especially brain, spinal cord, and other sensitive tissues. And apart from that, it carries nutrients and oxygen to cells, and it also helps dissolve minerals and nutrients to make them accessible to our body. So this is a pictorial representation of what we already have discussed. It is important in transport, it is important in waste elimination, temperature regulation, and also it is important in maintenance of internal environment uh, to enable efficient metabolism. So again, a pictorial representation of what all it does. Forms saliva in form of it helps in digestion, keeps mucosal membranes moist, allows body cells to grow and reproduce and survive, flushes body waste, lubricates joint. It is a major component of most of the body parts. It needed by the brain to manufacture hormones and neurotransmitters, acts as a shock absorber. It is helpful in digestion and helps deliver oxygen all over the body. And how do we calculate? In fact, there are a number of online apps to feed some baseline data, and you get the body water percentage of the body in the water. And then there are formulae, especially this is the most recognized one, Watson formula for males and Watson formula for females. Looks a bit difficult one, but then you have easy online apps where you can actually calculate the body water. And dehydration is a state when the body lacks water, and it is dependent on number of factors like environment. If it is a hot and humid weather, if you do more of exercise, high altitude, if there are illnesses like fever, vomiting, diarrhea, and apart from that, physiological states like pregnancy and lactation also are states associated with dehydration. Very importantly, you look at the y-axis, the physical performance goes down as there is increase in dehydration level. And very importantly, once you replenish the body water, again you regain the activity levels. And this is very, very important, the science of dehydration. And it is wonderfully depicted in this table. And the signs are basically dependent on the percentage of the body weight or reduction rate. If it is 2%, the first sign to appear is thirst. So very important takeaway point from this slide is that once you feel thirsty, you already have seen onset of dehydration in your body. So you should be going on drinking water throughout the day. 3% there is burning, thirst, absent-mindedness, loss of appetite. 4% it gives rise to flushing of skin, irritability, rise in body temperature, exhaustion, decrease of urine volume or its concentration. Once it is 5%, there is headache, people tend to feel feverish. Once it is 8 to 10%, there is swaying and convulsions also can happen. And over 20%, there is a significant damage to the kidney, there is anuria, and there is death. On the other hand, we have a state of excess, which is also called water toxicity or intoxication. Too much water in the body, as I've already stated, kidney can excrete 0.8 to 1 liter water per day. So, roughly, if you consume more than this capacity, you are going to all probably have water toxicity, which will be diluting the essential electrolytes in the blood. It will be giving rise to swelling of cells, there will be pressure on the brain, and there are a number of signs and symptoms associated with this particular imbalance, state of imbalance, where there would be dizziness, fatigue, or lightheadedness. There would be nausea, vomiting, or water retention. Muscular symptoms, you can have abnormality in walking. There would be cramping or muscle weakness. Also, there would be excess urination, mental confusion, headache,
Sir,
or
I'm so
yes.
sorry to interrupt you, sir. I think your slides are not changing.
Okay, but
Sir,
here
it's
I am.
on the incorrect slide.
Okay.
Uh,
What slide is being depicted to you now? Water
sir,
toxicity or
sir, the table that says age, that is divided age-wise.
then should I again stop sharing and restart?
I think so. Let us stop. Then we go to share.
Okay.
Sir, would you like us to share the slide instead?
I think that would be the best. Yeah, Sakshi, if you can
That would
share.
be fine. That would be fine.
Sir, I have, okay, sir, 1 minute. I'll just ask Pooja ma'am to do it. Just give me a second, sir.
मैं करता हूँ. Uh,
Sir, I think if we do it from slide
I'll share.
4, we can edit it.
No, I'll share.
Okay.
I'm sharing. Sunil, if you can just stop sharing.
Yes, I have already stopped, sir.
Okay. Okay. Are the slides visible now?
1 second, sir. Yes, sir.
Yes, sir.
So Dr. Sunil has begun speaking about hydration and diabetes, and the topic is our body, the water within. And he began with an introduction about how important water is to the human body. About two-thirds of our human body is water. Of course, there are changes in the body depending upon the age, the gender of the individual, and also upon the type of water. He described the averages for different ages and different genders, and we'll continue from here, from this slide.
So actually, I have gone on further also. You can go down.
Yeah. And
Next,
with
please.
age, the percentage of water keeps on coming down, but average that you can remember is 60% for the entire human body. And average that you can also remember is 60% for the whole body. A quiz question here would be, the blood actually has less water, only 50%, but the brain is more water, 80 to 85%. So if somebody tells you in colloquial Hindi or in Odia, तुम्हारे भेजे में सिर्फ पानी है, so actually the person is not wrong. What do you think, Dr. Sunil? How does it sound in Odia? What will it sound like?
तो भेजारे खाली पानी अछि.
So that is true for at least for me. And Dr. Sunil, how about you? What do your parents tell you when they're in a good mood?
The banging goes on, sir. It never stops.
Yeah. Yeah. And the best part is for all of us who are in a hydromanic state today, whenever you leave your family, your children, your spouse, and you sit down to listen to KK Med talks, that is what the entire family says about all of us. So, brain mein pani hai. So now after this talk, we will go back and tell them, you were right all the time. We don't argue with you. In fact, the body tissues with least water are the bones and the teeth. So these are the most solid tissues that we have. And flow of body fluids, would you like to start from here or go further?
Go further, sir. Actually, I
Go
have
further.
gone
So we've got the functions of the body fluid. We know how body
into the
fluid
details.
helps in metabolism, it helps in transport, it helps in temperature regulation, and in overall homeostasis. Without water, we can't have homeostasis. And the impact of water is all the way from head to toe. There is no organ of
Absolutely.
the body, no physiological system of the body which can work without water.
Yes, and there
Let's
are
start with
formula.
this slide. No, let's start with this because otherwise it is difficult to remember the formula
Yes.
without seeing the
Uh,
slide.
yes. So the percentage of the body in the water is calculated by this formula, which is there for males and females, Watson formula. In fact, it does look bit difficult, but then there are a number of online apps which will also help you to measure the percentage of the body in the water. But then these are not difficult to calculate, and you can use the online apps as well. Next, please, sir. Yes, the dehydration is very, very important. And as the dehydration percentage goes up, we have talked about the various kind of symptoms that we would be facing. But then the physical performance also goes down as there is increase in dehydration. And very important message that we get from this slide is that once the body gets rehydrated from -5 to 0 or neutral, again the body performance goes up. And again, the dehydration, there are some states where you would be having more of dehydration, like exercise, the environment when it is hot and humid, you have pregnancy, lactation, and there are some illnesses like fever, vomiting, or loose motions, which can also push you towards more of dehydration. Next, please. The signs and symptoms are very important. The onset is with thirst when there is 2% reduction of body weight, dehydration. And that's why it is stated that we should be continuously taking water throughout. That is the thumb rule, because once there is onset of thirst, means that indicates some sort of dehydration has already crept in. Then with 3% of body water loss, you have burning thirst, absent-mindedness, loss of appetite. As you go further, flushing of skin, irritability, rise in body temperature, exhaustion, decrease in urine volume or its concentration. With 5%, there are symptoms like headache, feeling feverish, swaying and convulsion. With 8 to 10%, when there is dehydration to the tune of over 20%, you get anemia and death can also be there. Next, please. And on the other hand, we have something called water toxicity or intoxication. As we have already discussed that, yes, the kidney can excrete 0.8 to 1 liter water per day. And if you take water which is beyond the capacity of uh, kidney to excrete, there can be water toxicity, and it has its impact in form of dilution of essential electrolytes in the body, blood in this. There will be swelling of cells, and there will be also pressure on the brain. And there are some symptoms like dizziness, fatigue, lightheadedness, nausea, vomiting, cramping or muscle weakness, and also common are excess urination, mental confusion, headache, or sleepiness. Next, please. So so we need to have the balancing act together. People can maintain the balance of water by drinking fluids throughout the day, because water is continuously lost through your breath, perspiration, urine, and bowel movements. And the recommended fluid intake milliliters per day is depicted in the table. 0 to 6 months it is 700, 6 to 12 months 800 milliliters per day, 1 to 2 years 1300, 4 to 8 years 1700, 9 to 13 years males and females it is 2100 versus 2400 milliliter. And for an adult it is 300700 milliliter for adult male, and adult female it is 2700 700, and all throughout you can see pregnancy and breastfeeding obviously require more of water because of the dehydration that is associated. And all throughout what you can observe is that males do require higher water intake than the females. Next, please. And this is very scientific one, water recommendation for Indians. This is the ICMR and the National Institute of Nutrition Guidelines 2020. So I'm just going to quote the requirement in adult men and women. That is, men it is 32 to 58 ml per kg body mass, and adult women is 27 to 52 ml per kg body mass. And it is stated that roughly 15.5 cups in males and 11.5 cups per day in females. That's the way to go forward. And very importantly, I would like to add something over here. How do we know that the person is having drinking enough? If the person's intake is probably adequate if he rarely feels thirsty and if his urine is colorless or light yellow. And of course, it is always a good idea to drink a glass of water with each meal, between the meals, before and during before, during, and after exercise, and also whenever you feel thirsty. Next, please. So that takes us to the question and answer. We have two quizzes also. Quiz questions. What are the ICMR NIN recommendation for water for an adult Indian woman?
Yeah, these are quiz questions for the audience. And please send in your answers the way you normally do. We have two questions. Dr. Sunil will read out both of them and the options as well. All the people who answer correctly will get a gift, an Arzal Zero pack.
So what are the ICMR NIN recommendations for water for an adult Indian woman? Option A is 32 to 58 ml per kg body mass. Option B is 47 to 60 ml per kg body mass. Option C is 27 to 52 ml per kg body mass. And option D is 38 ml per kg body mass. So there is a lucrative offer as stated by Sanjay Kalra sir. So please chip in with your answers.
And the second question.
Yes. Which of these is not a sign of dehydration? We have already talked about a number of signs appearing depending on the percentage of the body water loss: convulsions, fever and headache, anxiety and depression, absent-mindedness, or loss of appetite.
These are our two questions for the quiz. And like you always answer, we have answers from across the country. In Diabetes Essentials, there is a different quiz which goes on. In our hydration series, this quiz has started today. Thank you, Dr. Sunil, for all your comments and wonderful insights into water. But can I ask you a question, a personal question? We have lots of questions. We'll take them up one by one. But the question is, in your OPD, how often do patients talk about diet, about water as part of diet?
It's not very commonly that we see, sir. In fact, during the season of summer, and when there is more of moisture in the whenever there is more of moisture in the air, like in the rainy season, and especially in the hot and humid weathers, those are the times when they talk about more of uh, the intake pattern of the water. But then in my routine practice, I am sorry to say that I do not listen probably from their part what is their take on water intake. What about you, sir?
Not earlier, but now I've begun doing it, and that is an honest confession. We learnt about the concept of hydration as a treatment for diabetes: primary prevention, secondary, tertiary prevention. I mean, I think
Can
I
you
knew about
enlighten
it.
a bit more on this, sir?
So I learnt about it just few months ago when I had to prepare for a talk. Primary prevention means that if you drink water, you will get less diabetes. And there is actually study on that. People who drink more water have less new onset diabetes. Also, people who drink less carbonated beverages or less alcoholic beverages have new onset diabetes. So that is primary prevention. Secondary prevention is well hydrated people have lesser postprandial excursions of glucose. So if you drink more water, the glycemic index of a particular food goes down and the excursion goes down. So if you drink water along with meals, actually you end up reducing postprandial glucose. So when you are struggling in the OPD, you are increasing tablets, you are increasing insulin dose, you are focusing on diet. Madam, don't take fats. Sir, don't take ghee on your chapati. Don't take rice and take more proteins. When you are doing all these things, why not speak about water? Madam, why don't you take 2 glasses extra of water? Let us see what happens to your postprandial glucose. So that is secondary prevention. And tertiary prevention is, we will discuss this in the coming episodes. What do you do when someone has kidney failure, when someone has heart failure, when someone has dehydration, if there are complications? Then also you change the water intake to improve symptoms. There are some drugs like semaglutide and acarbose, even thyroxine in hypothyroidism. You have to mention the amount of water that the patient has to use to take the tablet. Same for some drugs used in osteoporosis like alendronate. So these are all things that have come to my mind recently only in the past couple of months. We apologize to everyone for the technical glitch regarding the slides and thank you all for being with us. Dr. Sunil, greetings to you from so many people, from Divya Chaudhary ji, from Dr. Akshita, Dr. Kannan, Dr. Jha, Dr. Vishnu, Dr. Sanjeev Puri, Dr. Anupam, and from your neighboring state, Dr. Anshul Singhai is there from Bhilai in Chhattisgarh. So everybody is greeting you. One question coming from Dr. Jha, that is, Enerzel Zero is a good 0-calorie drink, which has electrolytes, which has water, obviously. So can we drink it cold or can we drink it at normal temperature, or both are okay?
Probably, as far as my understanding goes, it can be taken with normal temperature water also. We don't require any specific conditions for that.
Temperature. Both are fine as per the patient's choice. How I use Enerzel Zero in my OPD practices, supposing somebody comes with ketonuria, we want to start insulin. Patient is from far off place. I know that patient will not be able to come back next week, not before 2-3 weeks. So we give first dose of insulin, ask the patient to stay in the OPD, and we also tell the patient to drink 1 bottle of Enerzel Zero along with water. And then you check the urine and the glucose after 1 hour. Usually that small or moderate ketonuria, either it disappears or at least it reduces to from moderate to small or from small to trace. And in that 1 hour, you are able to educate your patient.
That's a wonderful thing, actually.
Another way I use it is, especially in summer, but also in other months, if my diagnosis is heat exhaustion or my diagnosis is hyponatremia, but patient is not willing to get the investigations done, or patient is not able to pay for the investigations, or maybe patient complains of ghabrahat. Now, ghabrahat, Dr. Sunil, is such a symptom, you will agree, there are at least 33 crore differentials for ghabrahat. So now, is the ghabrahat because of unstable angina? That is my biggest fear at any point of time. Should I refer to the cardiologist or not? Then one of my common practices is, why don't you take a bottle of Enerzel Zero, and maybe to that we add a tablet of Stemitil mouth dissolving, or maybe clonazepam mouth dissolving, and wait with us for 15-20 minutes. If you're better, then usually the diagnosis is hyponatremia or heat exhaustion, and the patient goes back home. If the patient is not better or says that the ghabrahat has worsened, then certainly we refer to the cardiologist next door. So these are some ways I use. Dr. Sunil, how does it work for you when a patient complains of ghabrahat and diabetes? What are the things that come to your mind?
Yeah, probably the first thing that comes to mind is obviously hypoglycemia, hyponatremia, and as you have rightly stated, if the person is elderly and if he's having any other risk factors, then all probably I make it a point to get the ECG done. And as you have rightly stated, probably these are some of the important clinical cues, like where the patient is not very much eager or the patient is not in a state to go for the test. We can always go ahead with this simple things of giving an azal and giving antiemetic, and then seeing whether he's improving or not.
And the point raised by Dr. Sunil is valid. If you suspect hypoglycemia or you document hypoglycemia, then Enerzel would be a better option. But if there is euglycemia or hyperglycemia or a patient with known diabetes, then Enerzel 0 is better. And now there are different flavors also, I think, which and you can use them according to your patient's preference. We also welcome with us Dr. Sailesh Metalia, Dr. Savita Parnaik, Dr. Jagdish Toshniwal. Thank you for taking part in the quiz. Dr. Vishnu Mulchandani, thanks for staying with us in spite of the technical glitches. And Dr. Sunil, warm greetings to you from Dr. Suneet Verma, who is a leading physician of Panchkula in Haryana. And he is a fellow hydromaniac, doctor. So
It
we
indeed has
thank
actually
everyone.
raised a lot of interest.
Yeah. We thank everyone for all their questions and comments. And we look forward to meeting you again in the next episode of our hydration webinars. That will be 14 days from now. And our speaker is Dr. Saptarshi Bhattacharya from Apollo Hospital, New Delhi. I acknowledge the comment by Divya ji asking us कि हिंदी में भी explain करें. उसके लिए दिव्या जी हमारे पास डॉक्टर सुनीत वर्मा होंगे पंचकुला से, जो आज लॉकडाउन भी हैं, और इंग्लिश और हिंदी में मिक्स करके हम सभी कुछ डिस्कस करेंगे पानी के बारे में, हाइड्रेशन, कि पानी एक दवा है या एक प्रिवेंटिव बचने का तरीका है शुगर से. एंड दिस विल बी ऑन द 24th of February, 24 फरवरी को शाम 7 बजे के मेड टॉक्स पे. तो उसमें हिंदी में डॉक्टर सुनीत वर्मा हमें एक्सप्लेन करेंगे. और अदरवाइज ये जो डॉक्टर्स वाली सीरीज है ये ज्यादातर इंग्लिश में ही चलेगी every 14 days, and we will have a total of 7 episodes for this. So once again, Dr. Sunil, I'd like to thank you very much. पर एक बात तो बताओ Dr. Sunil, question from everybody is, what is the tastiest water that you can drink in Odisha? Low calorie, high potassium, high calorie, tasty. So one of course is Enerzel and Enerzel 0 and Blitz. That is one. But what else is there in Odia cuisine?
Not able to recollect, sir. Probably coconut water. It is available everywhere, in fact.
Yeah. So if your patient has access to coconut water, that is also a good way of replenishing electrolytes.
Coastal belt. Yes, sir. Long coastal belt having a lot of coconut trees, so that again is a one easily accessible thing.
Right. So that is something. And on that note, we'd like to thank everyone. Thank you, Dr. Sunil, once again. And back to Rahul and team FDC.
Thank you, Dr. Kalra sir and Dr. Sunil sir, for taking us through today's topic, which seemed very simple, but there was a lot in it to understand and to learn from this module. And I hope we have answered all the queries and resolved all the topics pertaining to the today's module. Thank you so much, sir. Thank you, viewers, for taking out time attending the module today. Thank you.
Thank you.